Hello, my name is Brian Lynch and I'm the founder and chief promoter of the Focal Therapy Clinic, which we set up in 2019 to provide men in the UK with an alternative offer to the more traditional radical prostatectomy or radiotherapy treatments if they have early stage localized prostate cancer. We've made a lot of progress since our initial start. We've treated over 3,000 patients in the last years and have been operating out of London, Southampton, Birmingham, Guildford, and are soon to be operating in Manchester and Bath in the next months. Every one of our patients is reviewed at our weekly MDT, which we have every Tuesday night. That MDT is regularly attended by each of our consultant radiologists, Mark Laniado, Raj Nigam, Alan Doherty, and Tim Dudridge, our clinical oncologist, Christos Mikropoulos, and our world-class uroradiology team led by Dr. Claire Allen and Dr. Francesco Giganti. Every patient is reviewed and we really carefully assess what the best treatment option for them is given the state of their disease, but also their own personal values and priorities. One of the things we're very proud at the Focal Therapy Clinic is that we have pioneered the use of MRI ultrasound fusion, which is where we combine the information from the MRI image with the ultrasound image to allow us to get literally millimeter level accuracy in treatment. And this has really helped us to take forward the state of focal therapy treatment in the UK, to the extent that we can show that our recent audit of our results at 1 year showed that 90% of men were completely clear of any identifiable prostate cancer. Of the 10% of men who had some additional prostate cancer, 5% had some, usually at the edge of the treatment area, which we were able to treat again with another focal therapy. And 5% had men which occurred in other parts of the prostate, which we had not been able to identify at the time of diagnosis. For patients who are looking to find out whether or not focal therapy is a realistic option for them, I can promise you that your case will be reviewed carefully, clinically and objectively by the MDT at the Focal Therapy Clinic to make sure that we help you select the best treatment for you. If you're curious about what you should do next, about whether or not focal therapy is right for you or what prostate cancer treatment is right for you, please feel free to make contact with us at the Focal Therapy Clinic. If you can't answer the phone directly, we'll get back to you within the next couple of hours. You'll have a chat with one of our patient advocates who can give you potentially 30 minutes of time just chatting about the options, chatting about what's available. And if that is appropriate and you feel appropriate, we will then make a referral to one of our consultants where you can go and have a proper appraisal of your case.